Good evening. Welcome to the Ask Me Anything with Dr. Twyman. I'm a board-certified cardiologist helping people not have heart attack and strokes, owner of Apollo Cardiology in St. Louis, Missouri. So doing these Instagram lives every Monday, 6 p.m. since at least about 2000 or so. Started these during the pandemic to help people out on how to optimize their health when they didn't have access to labs or doctor's offices as much, and been doing it just as a habit since then, but also really enjoy answering people's questions, helping them educate themselves about their vascular system, get the right test with myself or your own doctors, and we'll jump into the questions in just a moment. But a little bit of housekeeping, 2 items is I do have a school community. It's school, spelled with a K, .com/my name, Dr. Twyman, and there's a 7-day free trial. I have a couple courses on there. One's about how to read your own labs, and I actually just recorded a new video on how to review a Boston Heart Lab panel. So if you're interested in that, it's going to be available there starting tomorrow. I had a poll up earlier last week, and the poll that won was nutrition. So I put a 5-minute explainer video of my thoughts on nutrition as of 2025. So go back to my old YouTube channel videos. I still do have the 4 pillars of optimal health, and nutrition is on there, but I haven't updated in a couple of years. So if you want to hear my newest ideas, check out the school community. And then the second piece of housekeeping information is that there's still time to sign up for the Canyon Ranch retreat that I'll be hosting at the Halloween to November 2nd this year at Tucson's facility. It's an amazing facility. I've been there a couple times before. So if you're interested in potentially going on some morning hikes with me, going out to breakfast at the main dining hall, doing some Ask Me Anythings live there, potentially some poolside chats, I'll put a link in my story afterwards that has some contact info. There's an 800 number if you're interested. There's no registration fee from my standpoint. It's just you're paying the room and board to stay at the Canyon Ranch, which is a 5-star luxury wellness resort, which is amazing. I definitely would recommend checking it out if you've never been before. But I'll let you guys know if I'm going to do any of those type of retreats in the future that are more formal. This one's a little bit more informal, where you're just mostly just going to hang out with me and ask me questions if you want to. So we'll jump into the pre-submitted questions here now. So first question, known risk with invasive angiogram, but are they only during the procedure or after? So I was an invasive cardiologist when I got out of my training in 2012. I opened Apollo Cardiology in 2019 and gave up the cath lab at that point. So I still do know about this. It will depend if it's a diagnostic angiogram or if it's an actual planned intervention. If it's a diagnostic angiogram, very small risk during the procedure of bleeding. There's always a risk of damaging one of the blood vessels. Very small risk of stroke from knocking a plaque from the aortic root into the carotid arteries. And there's always a risk of a contrast allergy. The interventions, where balloons and angioplasty are being performed or stents are being deployed, there's more risk of microembolization of the plaque downstream, and you can get no reflow phenomenon. The greatest majority of the risk are during the procedure itself. Afterwards, you're on anticoagulation often, and there's always a risk of bleeding afterwards as well. Question, is it safe to take DHEA and testosterone if you have a calcium score of 44 and are a female? This is something where I can't give people one-on-one medical advice. You would need to know more details, history of any type of reproductive cancers. Do you have issues with polycythemia, sleep apnea? So unanswered questions, but if you work with somebody who's a hormone replacement specialist, these hormones can be safely utilized in that population. And there's a question about, do ketones benefit the heart and arteries? There's no great studies that look at this. I would think that the only benefits really are generally in diabetics and patients with cardiomyopathies. But this is something that is definitely in the biohacking realm and not something that is standard medical advice, so not in my area of expertise, so I don't utilize these in my patient population. There's a question about the Connect QT. So the Connect QT is a blood pressure device that also looks at central aortic blood pressures. The question is, do doctors know how to interpret the abnormal results and how to treat it properly? It depends on where they've been trained, but cardiologists would know how to. The central aortic blood pressure is what we measured in the cath lab when we put a pigtail catheter in the aortic root and measured the pressures. That is the pressure that your coronary arteries, your carotid arteries, your kidney arteries all sense. So your central aortic blood pressure is the most important metric to measure on that device. And that's the one that you ideally want less than 120/80. Are there supplements to help moderately high blood pressure? Yes, but it depends on test, don't guess. Sometimes we'll be able to find certain deficiencies. Person has high uric acid, high homocysteine, low nitric oxide, low magnesium. So you replace what is deficient. There's not a supplement stack that all should be taking for blood pressure, but there are some supplements, particularly magnesium and nitric oxide promoters, that are generally well tolerated. Somebody says that they take metoprolol for rapid heart rate. Is it possible to come off of it? They do cardio daily. So again, a question I can't directly answer because I don't have medical privileges to treat people over the internet. And it also depends on why the heart rate is high. Is it due to a thyroid issue that has been treated? Is it deconditioning? Doesn't sound like it. Is it anemia? Possibly. Is it an arrhythmia? Is it supraventricular tachycardia? Is it premature atrial contractions, premature ventricular contractions, atrial fibrillation? Is it ventricular tachycardia? So what is causing the rapid heart rates and why are they using beta blockers? But if they've treated the root cause, it was ischemia, it was thyroid, it was anemia, then possibly beta blockers can come off. But generally you do have to wean off beta blockers, otherwise there can be a rebound side effect coming off of it too quickly. 25-year-old female, D1 athlete, exercises regularly, having high blood pressure up to 200 millimeters systolic. Possible causes. This is actually a very common kind of board review question. So this is not, run-of-the-mill idiopathic hypertension. It's often going to be some primary cause. So coarctation of the aorta, renal artery stenosis, pheochromocytoma. Those would be the top three off the top of my head. The way to figure that out is with blood work. You can also do a good physical exam and see if there's differential pulses in the upper extremities. Are there diminished pulses into the lower extremities? That may be the coarctation, where you basically have a pinch in the aorta. Sometimes you would have a bruit over the kidney arteries. That's generally relatively hard to auscultate. So a kidney ultrasound can see if there's issues with the arteries going to the kidneys. You can look at renin, aldosterone in the blood work. So definitely something that can be figured out. But 200 systolic is very, very high and will need medical treatment. And you want to work with somebody who is an expert in hypertension. And not just say, here's some medications, because there's going to be some primary cause for this, and sometimes that's reversible if you treat that primary cause. And I don't know what this question means, so you might have to send me some more background and like a DM or something. But is the calf, meaning your leg calves, considered the second heart? I would not know how that would be connected, other than the muscle is contracting blood through the arterial and venous system, and it's helping structure the water, possibly. I don't know exactly what else you're trying to get at with that. So send me some more details, please. And any thoughts on what might cause a type B aortic dissection if someone's healthy? So assuming they have normal blood pressure, they're not abusing illicit compounds like methamphetamine or cocaine, which I've definitely seen both of those drive aortic dissections before. They've not been in a car accident, had traumatic injury to the aorta. Then would think about some genetic abnormalities like Marfan syndrome, Louis-Dietz syndrome, or some other connective tissue disease would probably be the most common reason why somebody would have a aortic dissection and have no other known risk factors. But high blood pressure, tobacco abuse are the biggest drivers. Thank you very much. Somebody says that they've been sending me some patients. Awesome. So Polycardiology is in St. Louis, Missouri. I work with patients from all over the country, and actually I just had another gentleman from Australia fly in last week to see us. So worldwide. So if you're potentially interested in working with us, my website, drtwyman.com, has an application. Somebody from my team will get in touch with you and set up an onboarding call and work through any questions you have about how our practice works. So this is a long question, but I'll try to kind of do it bullet point style, and maybe at some point, I'll do longer videos, but those will either be on YouTube or on my school community. But somebody says, favorite strategies to reduce plaque, optimize nitric oxide, support the glycocalyx, keep oxidative stress and inflammation low by checking labs with either Boston Heart Lab or Cleveland Heart Lab, and then treating the dyslipidemia if present, generally wanting to see people less than the 20th percentile for their lipoproteins. So an ApoB of under 70 and an LDL particle less than 1,000, utilizing whatever tool necessary. Let's see. Reducing blood pressure, optimize nitric oxide, exercise, sauna exposure, lower inflammation, earthing grounding, omega-3s through diet, potentially curcumin to lower TNF-alpha, but generally find the root cause of the inflammation to lower it. Exercise, zone 2 to optimize mitochondrial efficiency, strength training to optimize muscle mass. And then we'd love to hear some other evidence-based strategies other than statins and Repatha. So, you can use, if you're into using pharmaceuticals, ezetimibe or bempedoic acid. But I tend to still believe that it's important to focus on the surfaces of the arteries, the endothelium and the glycocalyx is the barrier. If you keep your glycocalyx healthy, it's less likely the lipoproteins are going to retain an intima and kick off a cascade where more plaque is formed. So cholesterol is just part of the story. Half the people who have heart attacks have normal cholesterol. But if you have significant plaque in your artery, a lipoprotein dropped that cholesterol particle into the artery and dropped off its payload into the artery. So cholesterol still does play a role in plaque. It's just not the only thing. What is the latest on the LPA drugs? There's still 2 drugs that are vying to be first to market. Probably won't be until 2026. How effective will they be? Some are reported in 80% effective. One's reported as 95% effective at lowering LPA from its baseline. Would they combine well with PCSK9? Potentially. Or statins or ezetimibe. They work through different mechanisms. So the antisense oligonucleotides or the small interfering RNA will work directly in the liver and basically shut off the body's ability to produce the proteins that stick to an LDL particle and make it an LPA. The drugs will be very effective, but the FDA has a high hurdle rate that they have to prove that these drugs lower cardiovascular events, MACE, major adverse cardiovascular events. So people are going to have less heart attacks, strokes, need for stents, bypass surgery, or die before these drugs are going to get approved. And then unknown what the cost point will be for these. But if they go according to history, what PCSK9s were when they hit the market, those drugs were generally priced about somewhere in the neighborhood of $12,000 to $15,000 a year, and were only utilized for people for secondary prevention. So many people already had cardiac events. I suspect this will be the same with the LPA drugs, is that they will only be approved for people who've had prior cardiac events. So if you have just high LPA, no heart attack, you can buy the drugs, but the insurance companies aren't going to cover them. They'll have to do studies in primary prevention at some point to be able to show benefit there as well. But the interim, until the drugs are on the market, work on all the other risk factors, lower the LDL particles using whatever combination of, pharmaceutical, nutraceutical, and lifestyle interventions you need to do. I usually look at LPPL2 activity, OXPL, ApoB, and interleukin 6. If those 3 labs are normal, then LPA is probably not damaging the arteries at that time. All right. So it looks like that was the last of the questions. So the housekeeping at the beginning was that I do have a school community, skool.com/Dr. Twyman. that's where my longer form videos are going. I did a updated nutrition video last week for somebody who asked, and I have a new video in the pipeline that is how I interpret a Boston Heart Lab panel. I go through the entire lab panel and talk about lipoproteins, inflammation, metabolic health, thyroid function. The person did have high LPA, so I went through why it was important to look at certain labs on that panel. So if you're interested in that, the school community does have a 7-day free trial. You can check it out if you're interested in staying. There is a nominal fee to stay. That way I can make sure that people who are really investing in their health will have access to that type of content long term. And then if you're still potentially interested in attending a very informal get-together at the Canyon Ranch in Tucson, Arizona in October, which is the 31st of October through November 2nd, I'll be there doing some hikes, training for my Kilimanjaro hike in 2026. But if you're interested in potentially having some meals, doing some poolside chats like this, ask me anything, then sign up. The sign up will end in about 2 weeks. I will put the link in my story. And if you're on my newsletter, which if you're not, you can sign up at drtwyman.com. There's a link there to sign up for the newsletter. It's going to go out in my newsletter in the next 24 hours as well. So I'll answer the one last question that popped up, and then I'll let you guys go. So somebody says, are PVCs during exercise dangerous? Potentially. It can be a sign of ischemia. So depends on what your other risk factors are. Are you having symptoms? Are you passing out? Are you having other things where it would be likely why the PVCs are present, like low potassium, low magnesium? So unknown, is it dangerous? Not always, but does probably need a workup. So with that being said, guys, I appreciate your time and attention. Every Monday, 6 p.m. Central Time, I'll be back answering your questions. So have a great week and take care.